Hey, Eyes and Shine, everyone, and welcome to the I Give a Damn podcast, made possible by Fluorescene Media, the same company behind ODs on Facebook. Now, I first want to start off today by first thanking our video sponsor, that of Lens Therapeutics. Now, if you are a doctor who's ever prescribed for presbyopia, then I'm sure you're a master at bifocals and progressives and multifocal contacts and even surgical options for your patients, but you've been probably pretty excited with the development of presbyopia eye drops. Now, I've been digging into the research and reading kind of what's coming out, and it's kind of fascinating because we really only have three miotics. We have pilocarpine, we have carbachol, and now we have aceclidine. And if you're not super familiar with aceclidine, that's okay because it's just coming to US markets. But aceclidine is pretty special because it is a selective miotic, meaning it predominantly affects only the iris sphincter and doesn't activate the ciliary muscle, meaning you can therefore avoid the myopic shift. And what I've personally been finding super interesting about aceclidine and kind of what Lens Therapeutics has released in their phase 2 research is that their formulation of aceclidine has a duration lasting 10 hours. And that means that in the near future, we may have something available where a patient could just take a drop in the morning and go throughout their day without having to reach for things like reading glasses or maybe even concern themselves too much with bifocals or even multifocal contacts. It gives us this whole other avenue. Either way, I think it's all super fascinating and something that we should all be paying attention to. Otherwise, thank you again to Lens Therapeutics for sponsoring the video. Today, my guest is Dr. Tim Earley. Dr. Earley is a practicing OD at the Medina Vision and Laser Center in Ohio and has seen great success throughout his career as a private practice owner, as a lecturer and speaker, as well as his own ventures into public health, as he is the director of the Bright Eyedeas Vision Clinic, offering free, no-cost eye exams and eyeglasses to people in need in his community. Today, Dr. Earley and I discuss career paths, not only how he found himself in his passion and practice of optometry, but ultimately how things changed and how he went from being a practice owner to an employee, as he shares his personal experience and thoughts going into private equity. We also discuss his passions for speaking and giving CE, as well as his involvement in starting a no-cost vision clinic. Clearly, Dr. Earley is somebody who gives a damn about optometry, about his profession. So please join me and support us by hitting the like, subscribe, and follow buttons. And here we go with Dr. Tim Earley. Tim, thank you so much for being here.
Well, thanks for having me.
This is a huge, again, honor as it is with every guest, but you and I have had a chance to kind of connect and talk, and it's just been a pleasure getting to know you and hear from your experience. So I'm excited to kind of have everybody who's listening in, watching, kind of get to know you a little bit better too. So,
well, I can't thank you enough for the opportunity, and I think I shared the first time we talked that I've been a big fan of your content for some time now. I think I shared with you the genuineness of the material, and I just love the way that we're also educating not just our colleagues but also our patients. I think there's some misinformation out there, so getting, unbiased, good information in a fun kind of format, I think, is very, very palatable for patients and things. It's not scary, and you've tackled some topics that were potentially scary for some patients, so we appreciate that.
And thank you. That means a lot. It's at least with venturing into this space, I was really nervous of how our profession would see myself just trying to talk and present our profession in kind of a TV show sort of way.
Yeah.
And I was really nervous about it. But the more I've gotten good feedback from people, it's really made a difference. So thank you.
Don't stop doing it.
No.
I think I'm not the only one out there who follows you closely and really enjoys your content.
Thank you.
Yeah.
Well, for our viewers, listeners who don't know you, please, if you mind filling us in on just kind of how you got into optometry and kind of where the profession has kind of taken you over these years.
Sure, that sounds good. So I'm originally from a little town in northeastern Pennsylvania called Honesdale, and my older brother and I are first generation college students. My mom and dad, super hard workers, but I remember my first job was actually working with my father on a construction site. He built homes, he and my grandpa. And I was not the most gifted contractor or construction person. I had some injuries, we'll say. And I remember one day I fell. I was on a job site and I fell. And my dad came home from work that night and asked how I was. And he was very honest. He goes, Tim, you might want to consider another career. And he said something along the lines of, I would go use your brain to make your living, kind of thing. And I was a pretty small guy. I was slight of build. So my next job actually was I went to work for an optometrist. My best friend was a tech there. His name's Dr. James Lynch. Shout out to Dr. James Lynch. And Jim and I actually were technicians, and we ran the optical. We actually made glasses, lenses for summers and over breaks for about 2 or 3 years. So that was my first foray into optometry per se. But I would say a lot of the inspiration for getting into optometry also comes from some family situations. My mom is an insulin-dependent diabetic. We knew that from the time we were little kids. And she was diagnosed in her teens. And I was in undergrad, and I was asked to do a paper. So I wrote a paper just on diabetes itself, the disease, and in doing that research, discovered the damage it could do to the eye. Yeah. And I remember thinking, it'd be really, really nice to make sure that my mom has someone who can watch over her as she lives through this chronic condition. And having worked in the optometry office, I thought maybe optometry would be a good career for me. So that was my I guess the impetus behind my desire to kind of go into optometry as a career. And so I went to undergrad at the University of Scranton. Right.
which I just love because some other friends and I really get into the show The Office for people who haven't seen that.
So for years, if I would go around and do some lecturing and things around the country, and I would share with folks that I'm from Scranton, their eyes would kind of glaze over and like, yeah, whatever. But now if I say the word Scranton, I hear a lot about, hey, Dunder Mifflin. It's much more recognizable thanks to The Office. But my undergrad was in biology, and not long after graduating, I moved down to Philadelphia, got my doctorate at the Pennsylvania College of Optometry. As luck would have it, I think I shared the story with you as well. My wife actually was from Ohio. She transferred into PCO from Ohio State. And after graduation, we married maybe 6 months before we graduated. Wow. And we moved back to Ohio. So I've been in practice in Ohio since 1998. And another quick shout out, my partner of 25 years, Dr. Christine Biling, just retired after being in practice there in Medina since 1990. Wow. So she was, in fact, I had never practiced a day in my life without her until about a month ago. So a lot of what I learned those early years in practice came from my partner, Christine. And it was wonderful. Medina, where I practice, is a town kind of between Akron and Cleveland. And great community, a lot of really, really great families. And we got really involved in the community, nonprofit organizations and boards and the Chamber of Commerce. And, we built our practice organically, doing that. And I guess there's been a little pivot, over the years. I realized, and folks would tell me that I was a good teacher. Like I'd be in the exam room telling somebody about an eye disease, and a patient would say, wow, you explained that well. Thank you, And I think it was Christine that said to me at one point, you should do more of that. It's something that you're very good at. And as luck would have it, a couple of the local reps that were coming into our practice, contact lens reps and pharmaceutical reps, would say, yeah, if you ever want to, lecture for us, we'd love to have you, kind of thing. So I got my feet wet back in maybe 2010, 2011, somewhere in there. And there for a few years, if someone called me and said, hey, Tim, would you like to do a dinner meeting and lecture on a new product, I never said no. I would just go. Sure. It didn't matter where it was. I've traveled some very remote places to give lectures, but it was wonderful in that I was able to, I guess, get my feet wet and like work on how I present myself, in a presentation or in a dinner meeting or in a lecture. And I'll tell you, I wasn't very good. Like I was always nervous. I could tell I was nervous, and lots of ums and ahs and vocal pauses.
It's a skill set, No one's really just born with that knowledge or experience. It's something you refine and work on, just like in everything else.
It's no different than being an optometrist, right? It's, you look back when we did hour-long eye exams coming out of school, and every single test known to man, And then you become really good at the problem-focused visit, and you kind of titrate things down to make it more enjoyable for the patient, maybe.
Yeah.
But yes, I agree. I think that was something that I was very grateful to be given the opportunity from a couple of really good industry partners to kind of, they saw something in me that I probably didn't quite see in myself at that point. Something that I don't know. I think I'll only speak about those things that I can authentically speak to, that I've actually worked with, or I've done in my practice. So I find that makes it really fun.
And I think it's also a learning experience too, because when you're thinking about that and you're thinking, I'm going to present on this, you have to really know the science. You have to know the clinical part of it, and just kind of live, breathe, and have a passion for what you're going to talk about and explain. Because a lot of people have questions, and you're like, that's a good question. I'm not sure, but let me think about it. That's fascinating, and you refine things that way.
Absolutely. Yes, I feel like it's so much easier to handle a good question, and quite honestly, I definitely don't know the answer to all the questions I'm asked. No. I think none of us will, but it's just nice to have the experience in how to get that person the correct answer, or make sure that you've got a person who will know the answer that they can kind of get in touch with. Mm-hmm. But that's funny, because you're right. There's definitely, I guess, topics that are more near and dear to me. And because they are, you can go the extra mile when it comes to the research behind it, the science behind it. I think, going back to my mom, if I might, when she was diagnosed with AMD several years ago, it was probably pushing 10 years now, she called me and said, hey, Timmy, and she calls me Timmy, which I think is so cute. Hey, Timmy, my doctor, in Hohensdale, he's mentioned I've got some changes in my macula. And she asked me, what should I do? I don't want to lose my vision. I want to see my grandkids grow up, that kind of thing. And I said, you know what, Mom? I honestly don't know. The first thing that popped in my head was AREDS. AREDS has been the gold standard for so long. And I said, but and that might be the best option. But let me go do some research for you and find out what the latest science is telling us. So. And I'm sure you're like this too. Like, we go down this rabbit hole, and like you want to know so badly because it's your mom. You want to make sure you're taking care of her. So I think when I think back on the decisions I've made when it comes to like how I practice and how I approach the people who put faith and trust in me, my dad told me years ago. He's like, Tim, if the person in your chair, if you treat them the way you would treat your mom or you'll never go wrong. And every time there's a person in my chair who might be more challenging or might not be having a good day, I hear my dad in my ear saying, listen, treat that person, as if they're your mom or I think you can't go wrong then, Right.
And I think that's a wise thing. I think a lot of doctors will share that same sentiment. Yeah. But there are times where I stop and I've had to make those tough decisions of like, seriously, like, what would I do for myself? Like it's because what you've been drilled into your head from school, what you've read in books, but then that's not, in an academic setting, that's a little different than if you're in a true clinical and you have to make that decision, right? That's like the sign of a true doctor clinician is like, you have some responsibility on your shoulders to make that decision in many ways for your patient.
Yes, absolutely.
And I know it's an inconvenience for you that you need to wake up tomorrow morning to go into retinal surgery, but this is not something you can push off a week later.
We're not going to debate this.
Yeah, we're not doing this. You're going, and I'm calling the surgeon now to let him know that we need to get you seen.
Absolutely. And there's so many other factors that play into those clinical decisions and things. What I was thinking about as you're talking is the financial side of it. I was very fortunate about 10 years ago to work with two young students that were interning at my office. There's a program in Medina. It's called an optical technology program at our vocational school. And these two amazing young women were trying to put together, I guess it was a project for their high school. And they came to me and said, Dr. Tim, we're trying to put together this project. Do you have any ideas for us? And I said, what we don't have in Medina County is a clinic that addresses folks who are falling through the cracks, who don't have access to eye care. If they're uninsured or, God forbid, it's a child whose parents are incarcerated, sure. How are they getting care? So these two, Nicole and Allie, you're out there as well. These two young women put together like a business plan. I said, if you put this together and you get this approved, I will be the clinician. We can actually start a free clinic in Medina County. And sure enough, we did. We're going to be, I think this will be either our 12th or 13th year coming up this fall.
Wow.
And where I was going with that, Joey, is that has been completely life-altering. We spend at least 1 or 2 days a month during the school year. The students in the program do all the pre-testing. They do all the history taking. I do the exam, and the students come in. They can observe the exam and how it's done. I teach them how to do a refraction and how the slit lamp works. But then they make all the glasses. There's a lab on site. And what's amazing is that you really start to see that's where the mentoring part started to how she can look like.
Right.
And I'm happy to say we've got several of those students who are now optometrists. They went through the program.
Yeah.
I remember I drove a young guy, his name is Bilal, out to Philadelphia years ago to my alma mater and for his interview at PCO. And he's now practicing not too far from me. So it's interesting, like there's other parts. The financial side of it always comes into play when you're making decisions for patients and things. And there's definitely times where patients just simply don't have the ability to do some of the things that we recommend. So being able to pivot and try to find other solutions for them has been, it's challenging, but it's rewarding as well.
And I applaud you and you said what were the two women's names again?
Yeah, so Nicole and Allie.
And Allie. So
Yes.
Definitely, if they see this, hear this, big applause to all
They're
of you.
amazing.
It's amazing. I'm not only do you obviously serve your community through your normal clinic, but then to have this, like you're impacting so many people's lives, and you don't do this unless you're passionate about helping people, helping preserve sight, and giving that as a gift, and then teaching at the same time. I hope that I hope that you all feel very proud and good of that, and I think it's very special.
Been a really. Yes, I feel like there's a point in your life. Like I remember looking back on the first 10 years of my career, and I'm just trying hard to make my exams faster and not miss something, but also build a rapport with my patients that I hope is going to last a lifetime. But as time goes by, like I feel like the older I get, the more I feel like giving back makes even more sense. And it's not that I have any more time per se, but you make the time for the things that matter the most. And Amanda Pishak, who also, she's the person who runs that program, and it's her students who actually staff the clinic, is amazing. I mean, she built an exam lane in her classroom. That's where we do the exams now. I was doing it like in this little like closet for a while, or like in an extra classroom. But she was able to convince the school that this clinic mattered enough to our community that we should actually have, a stand and chair and a slit lamp. And so again, thanks to Amanda as well. There's people like that who are very much willing to give, to take care of other people. And I'm just part of a team. So I really can't take full credit. Thank you, but I can't take full credit. I've got so many amazing people who supported that endeavor for sure.
I wish I could give like an honorary I Give a Damn award for
That's
all
a cool
the people
idea.
involved
To Amanda.
in that.
Yeah.
So maybe we'll have to figure if we can do that.
That's cool.
This is all great. Thank you so much for sharing just kind of that journey.
Sure. Yeah.
I know another part of your journey that is pretty interesting is because there's a part of our profession, and it's part of many different parts of medical care and just business that you have some experience with, and I would love to hear. I think a lot of people would get good insight into just what your experience has been like, and that's with the eventual sale of your clinic. As you were an owner, and now you're kind of changing into a different phase of your career.
Yeah, that's such a good way of putting it, actually. So my partner and I, Christy and I, and I think this is a really important point to make before I even go down my journey. When you're in a partnership or in a practice, and you've got co-owners and things, what we realized very early on, number one is you play to your strengths. One of us might be really good with the numbers, and one is better with organizing the people part of the business and things, and we figured that out very early on. But what we also figured out was that we wanted to have an exit strategy that was going to be fair for both of us. And I think that was something that, Christine's a few years older than I am, and she kind of had a date in mind when she wanted to retire. And we started working towards that goal 5, 6, 7 years before we thought that would come to fruition. So I think for those who are kind of listening, I think, number one, having a plan, setting goals as partners in a business like this, I think was really important in order to strategize and get a plan that was going to be acceptable to both of us. So we thought for a long time that we would work with another, like a group like in our area. We're in Northeast Ohio, and we have an outstanding surgical extension of our practice. Some docs who have done our refractive and cataract surgeries for many, many years. Mm-hmm. In fact, we met with them probably 10 years ago and just said, hey, what would a partnership look like, you know? And the timing wasn't right, and we were still growing, and we had brought on some associate doctors, and we thought maybe some of those might want to be partners and things. So as time went by and the timing for Christine to retire was getting closer, well, we talked a lot about, you know, what it's going to look like. And we were approached, like a lot of practices are, approached by lots of the larger, you know, private equity-backed companies and things, thinking about, you know, could that be a good strategy for us to exit? So we did explore a bunch of those, and we're pretty far down the path at one point, right before COVID. Mm. So right around, you know, end of 2019, early 2020. And then things got kind of weird there for a bit because, you know, the equity markets were, who knows what, the capital markets were kind of strange. So we kind of sat back, and we got a phone call one day from our surgical extension of our practice, the docs we worked with for, you know, 20 years. And they said, listen, we're part of a group that we think you'd be a good part of as well. And again, this is during the COVID shutdown. It's like April, May of 2020. And we were gearing up for, you know, an exit strategy anyway. And we both, my partner and I, said, you know, let's at least explore this option and see what this looks like. So to make a long story short, we eventually partnered up with a group called Northeast Ohio Eye Surgeons. Our surgical team is called the Cleveland Eye Clinic under the umbrella of Midwest Vision Partners. So what's nice about that transition is we've never had to do anything different like with our surgical team. We've got the same, you know, EHR and systems. The communication between them and us has been, you know, wonderful. Like it's very, very, you know, straightforward. But going through that process, as I think I shared with you earlier, you know, I was a business owner and an entrepreneur, just like my partner. Mm-hmm. And going in, you have to kind of go in with your eyes wide open. I think that would be the advice I'd give to anybody looking at a sale or an acquisition. And we really did our homework. Yeah. You know, to be clear, you know, there's a lot of people who went through an acquisition by PE or other before we did. So I spent about a year or two reaching out to people who've gone through that process and would ask, you know, what's it like, you know, coming out the other side? And what's the day-to-day operations like? Important things like, were you able to retain staff? Because those things matter, you know. Sure. At the end of the day, you want to make sure you can still have a team there.
It matters to the community, your patients, the sense of service, your values, all of those things.
Absolutely. So, yeah.
And it's obviously, you've been working on this for how many years do you own this practice, right? It's very much a part of you, your personality, your life. Yeah. And that gear shift of like, I'm running the ship and now I'm working in the ship and kind of handing it off. That's
a big transition.
That is.
Yeah. And I think there were aspects of the day-to-day operations of the business that, you know, really we enjoyed. Like I love a good, you know, KPI, you know, glimpse or something I can follow my numbers with. Mm-hmm. Like that gets me all geeked out, you know. What's my single day use percentage in my contact lens business, and what's my capture rate in my optical? Like I love that stuff. And I still kind of follow that. But what happened for both of us, you know, as Christine was getting closer and I was doing more and more traveling. Actually, I had built a consulting business, and as time went by, I just felt like there wasn't enough time in a day, Joey, to do everything, you know, to run that business and travel and also see patients. And that's one thing I promised myself, is that if I was going to go out and consult, I would only speak about things that I was actually doing in clinic, you know, whether it was a device or a pharmaceutical or a contact lens. I'd want to speak from experience, you know. So it got to a point where, long story short, we ended up, we're part of a larger group now. It's like an ODMD group practice. What's nice is I was the HR director. You know, I was doing all the hiring and interviewing and, you know, termination and benefits and payroll, and I don't miss any of that. I'll be honest with you. Like that was actually, I think, probably the biggest upside of going down the path we went down. And I think that was probably the biggest impetus for me to become, I tell my patients, I'm just a doctor now. I'm just going to be a really good doctor. I don't have any control over the systems behind how the business operates anymore, but I'll take really, really good care of you, which is what I got into optometry for to begin with. But I do enjoy the entrepreneurial part. I've got a couple other businesses outside of patient care, like my consulting business, that I enjoy that. Like, I think there's got to be something else that kind of keeps me going. Like, I like to follow the growth of a business, you know? Yeah.
So that's great insight, because I know other doctors who've gone through those transitions, and I've witnessed, without even kind of having too in-depth of discussions, but I've witnessed kind of their, in some ways, emotions over facing retirement or passing on that, because again, that same thing, you're used to that. I guess nobody goes into owning a clinic or being a partner in a clinic without some drive, entrepreneurial spirit, and it's just a tough thing.
It is, you know, and I think you said it perfectly. I think that it's not just a business, right? It's basically, it's a part of who you are.
Yeah.
So that's a hard thing to. It's not that I walked away or we walked away from it, but the transition into a different role. I think when docs start thinking about what their exit strategy is, whatever that might be, it's important to be really very realistic about what it's going to look like for you on the other side. And I think that it's important to have those conversations. And I knew that I always wanted to be really involved in the consulting and speaking and teaching side. Yeah. And if it's something that I couldn't do within that new entity, I would feel no problem moving on into, you know, finding that passion, working with other industry partners, or working with other companies, or building my own consulting company. So that's kind of the direction I've been going.
And I think the reality is that if you were still making all those decisions, had to carry that weight of running that practice in that sense, you would not have the time or energy to do what you're doing now as a speaker, consulting, all of that. Or if you were trying to do it, you wouldn't be able to do it as well.
You're right.
And
You're absolutely right.
I think it's smart that you were able to recognize opportunity, think about it, analyze it. Certainly, you guys already had an amazing experience with other doctors who already were a part of that, and were able to make that phase shift. And so I have gratitude that you have had such good success with that.
Yeah, it was, and there's definitely been probably the most challenging part of, you know, after the acquisition has been, you know, patients notice there's some things that are different. And it really boils down to the systems that are in play, you know, because when you're a single location practice and you've been in the same community for, you know, over 30 years, you know, you really get to know the wants and needs and what your patient base, you know, expects of you, you know, so to speak. And it's not neither good nor bad, but that changes when the decisions aren't coming from the people who are like right there on the ground every day. Right. You know, it's a different feel. It's a change. And that was something I guess I didn't appreciate as much as I guess you can't know that until you go through it, maybe, you know, and I think that was, so I definitely struggled with that at first. Like when a patient would say to me, hey, you know, this happened in optical and, you know, why don't you do blah, 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 because you always did that before. And I would have to say something along the lines of, well, you know, I'm sorry that was your experience, but you know what? That's not something I have any control over anymore. Like I'll make sure that people who are making those decisions know and get your feedback. But so that was probably the most difficult part. And now it's been, you know, 2.5 years, and I hear less of that because those systems have been in place for a while now. Right. But so I think the take-home message for a doctor who's thinking about, you know, where I take my practice. And there's a lot of, not that it's pressure to sell, but I know a lot of docs are approached to sell. You know, and I think it's important to have a very open conversation about what that could look like on the other side.
And that could happen, that experience could happen whether you're selling to something like PE or just selling to another doc or to an associate. Right? It's like you're letting go of those decisions, and you hope that, you know, you care for your patients, you want them to have the best experience possible, but, you know, tough economic times, you got to make decisions that keep the business afloat. Because if you can't, and the clinic closes, then nobody wins, right? Your entire community will suffer because the clinic closed.
Very true.
So that's just the harsh reality of business and changing tides.
You know? You make a good point too, Joey. Like the time that we decided to go through that whole process was probably probably either the first or second most difficult time that we were in practice. It was during the worst of the COVID pandemic, and when it came to, because we had so many other headwinds in addition to just the economics of things. It was the difficulty with maintaining staff, folks who weren't crazy about some of the orders for mask wearing and things.
Yeah.
So when you think about it, it was a very difficult time. And we got through that summer, and there's a whole PPP thing. We went through all that, So there's a lot that was going on there.
And I remember, I'm thinking back to that time of just dealing with COVID. And now that looking back, at the time I didn't realize how difficult or weird, foreign that was. You wake up and whatever came into the clinic or whatever policy change happened, you just kind of had to make do with it, right? You had to be flexible enough to be like, okay, well, we're going to figure it out.
Right. It changed every day. Or every week.
And now I think, now that there is a little bit more stability, predictability in where we're at, and the true reality is anything could change, right?
Right.
We
learned that the hard way, didn't we?
Yeah, we could dive back into another scenario like that, and who knows how many months. But it's, I think, certainly I know there's got to be eye clinics that did not make it through those tough times, but I think a lot of the clinics that did obviously learned good lessons from that.
Yes.
And I think also our patients maybe learned a lot of lessons too. Just understanding healthcare, understanding appreciation for those tough working scenarios. I know when a nurse comes in or any medical, like especially nurses, because they had a really tough time, as all medical professionals did with COVID. But anytime a nurse comes in, I'm like, I spend a little bit more time not just thanking them and asking them like, how are you doing? Like, I know you went through a tough time getting burnt out, or maybe they still are.
I had a dental hygienist in the chair yesterday, and we got talking about the same thing. And she said that how difficult that was, because dentistry was pretty much in Ohio shut down. It was.
How do you get in?
Yeah, you can't really do a whole lot with the mask on. So it was interesting to get her perspective and where they are now versus where they were at the height of COVID, when their business basically they had no control over their operations of their business. Yeah.
Well, with all of that being said, and now that you've shifted to being a little bit more speaking, consulting, which is clearly a passion of yours, you're working in the clinic how many days?
So 3 days a week.
3 days a week.
I typically work Tuesday through Thursday seeing patients, and what's nice about that is a lot of times if there's a regional meeting or a statewide meeting or a national meeting, they're typically over weekends, so that kind of works out pretty well. I can get the weekends in.
What's your favorite, if you had to pick one, and it's tough to pick one in eye care because we have so many different interests. There's so many, the breadth of optometry is so large.
Yes.
What is there a specific niche in eye care that you just love presenting, researching on? Yes.
Yeah. And so thanks for asking, because that's a tough question at times, because I think a lot of us tend to be generalists in a lot of ways. But really my big passion, and if you ask that question to any of my technicians who work with me every day, they would say without a doubt it's macular degeneration, managing AMD in our clinic. And I think it goes back partially to what my mom has gone through.
And she has both diabetes
and she also has
AMD. Yeah. That's a tough mix.
And she has glaucoma too. Yeah, so she's got a lot going on.
My eyes.
Sorry, Mom, if you're watching. I don't mean to be giving out your history, but I don't think she's going to care. But the bottom line is I feel like that lit a spark when it came to, number one, I was not doing a great job. I'd gotten lazy when it came to AMD because I was taught in school, as if a patient's in your chair and they've got any form of dry AMD, I'm sorry, Dr. Tim, but you can't do anything about it. And I think that was always in the back of my head. I go back and look at, ultra wide field images of maculas that I called early AMD for years that were intermediate or worse, because I did not know what a 125 micron druze was. So I look back at those days and I kind of shake my head, but the reality was that I wasn't trained to manage or monitor or treat AMD. I was trained to take pictures of it, watch it get worse, and then when it gets bad enough, send it off to retina. And when I realized after my mom called that day is that I was not doing the best I could by my patients. So it was definitely humbling, and it was definitely
it hurts, doesn't
paradigm
it?
shift. It did. But I vowed at that point that I would change the way I managed AMD in our practice. And so a lot of the lectures I give, if you ever get to one, like if you get to an AMD one, I think you'll feel the passion. I really, really believe that it's a disease state that we need our OMDs, our retinal specialists there to treat and to take care of those really bad cases. But it's also a disease that optometry can do a really good job of managing and preventing vision loss by early diagnosis and early management.
Because we're the ones who are going to catch it at the very tip of the iceberg.
Correct.
Right? That small single drusen, like, oh no, what is that?
And don't ignore that. And I think I was trained that, well, there's not much you can do, so you can ignore it. And there was a change, a little bit of a paradigm shift when we realized that you could do something with good nutrition, ocular nutrition. We've touched on that before too. And I believe that is in its infancy. We're going to learn more and more about the ways that we can kind of prevent disease in the retina and with good retinal perfusion and with having the right things in our bloodstream to help, regenerate or help support tissue,
right.
Retinal tissue or nerve tissue.
And a lot of that comes with new technologies, more research comes out. I was just talking about OCTA with Dr. Carolyn Major and like just how that being able to, like, we can see so much when we do a fundus evaluation, but once you see those images, you're like, oh my God,
there's a whole other level.
Yeah, there's so much more vascular going on that imaging technology can see than I can just pick up clinically. Yeah. So it's an exciting time, but I really I appreciate that you had that moment of self-reflection and being like, I can do better.
Yeah.
And I know I'm pretty hard at it. I think a lot of doctors are. Like you don't get through school without this much schooling without being a little hard on yourself about like, I need to kick it into higher gear. And so when I have those moments like, I don't know something, or there's something I can do better, or I learn from somebody like yourself, hey, there's something, there's more out there. I take it a little bit personally and just, I have to be like, I need to step it up into higher gear, not just because of me, but because I want to be the best doctor for my patients. I don't want to do a disservice to them. I don't want to hold something back from them. And so,
you make a really good point too, Joey. Like, there's so much happening in the eye care space, and I've said to one of my associate docs recently, I should definitely go back and learn how to fix sclerals. I don't have the time. Yeah. I should really get good at myopia management. And I do some of that. We've been doing like Ortho-K for years. Yeah. But I'm not keeping up on certain things the way a person who kind of specializes in that can. And it's not that I'm advocating for every optometrist having a specialty per se, but I'm a total nerd. So when I start to get into something, I kind of go all in on something, And I'm really right now, and again, it goes back partly to my mom, but I really feel that there is more we can do proactively for our patients who have diabetes, trying to find functional tests for whether or not that retina is having issues before we see major structural damage. And I think that's what I've realized recently. I feel like we've been trained as optometrists to understand how tissue should look.
Yeah.
And that's important. But if I say you have diabetes, I would not wish that on you, but say you do, and I see you once a year for an eye exam, how do I know how your retina looked 4 months ago or 6 months ago? I simply don't. So I am making a big assumption that you had no diabetic retinopathy 6 months ago. But if I can test how your retina is functioning, are those cells sick? Have they suffered damage over the course of that chronic disease? Is that just as, if not more powerful than just structural findings? Right. I would say marrying those two is really important. And
I'm just curious because you brought that up. Do you have any experience using like ERGs for those sort of evaluations of the retinal function?
Yes. So that's an instrument that we've brought into our clinic here just within the past year, and it's been completely changing the way I look at those patients that we help with diabetes and help manage. That's a really good. I'm sure you've heard of it as well. But yeah, But even like when it comes to AMD, dark adaptation testing is not new. Yeah, it's been around for a long time.
But it's getting a little bit more accessible now with the way technology's changed.
Yeah, so like I feel like that's why I enjoy the speaking and teaching, because like I feel like we're so busy in our practices. We're there 5 days a week, sometimes 6 days a week, and then we've got families that we're supporting, and so it's hard to know about all the latest science and technology, and it's probably easier to kind of focus on one disease that you're really, really passionate about. But dark adaptation testing completely changed the way that I manage AMD in my practice. It's something that it's over 90% specific and sensitive for folks who have damage in their macula from AMD. So it's something that I didn't run a dark adapt test until 5 years ago, and we probably run it numerous times a week, 10, 15 times a week now. So
I had an opportunity to use dark adaptometry and have my father test it, and I was worried about him because he'd been a smoker for like 30 years, and
you're a good son.
Yeah, and he, I had done his retinal evaluations too, and he had some pigmentary changes, and I was like, oh no, it doesn't. Maybe it's not AMD, it doesn't quite look and exactly look like it, but I was nervous, and I didn't want to hear that maybe there's a genetic link in my family either, right. For my own sake. But thankfully, he turned out fine.
Good, good, yeah.
It was one of those experiences, like, it is such good technology, and I just wish it was more. It is becoming more available, but I wish every clinic had quick access to it.
What's interesting, and I'm so glad your dad's good. I feel like there were a few patients over the course of my career that went seemingly from like no AMD to wet. And the reason why is I believe I missed it because I was looking for structural signs, like, drusen. How many drusen are there? Are they soft drusen? Are they calcified drusen? How many are there? That kind of thing. And I have a gentleman I can think of, he was from my church, really, really great guy. And he went wet on my watch. And I went over his Optos images over and over. And there's nothing on those ultra wide field images that would indicate AMD. And his other eye has been fine. We've been managing him for over 10 years now. But that was one of those like sleepless night kind of moments where you're like, can I be doing more? How did I miss that? How can this person go from seemingly subclinical or no AMD to wet? Is there a better test that will allow me to measure not just what that macula looks like, but the functioning of that tissue? Is it functioning properly? So I always wonder what it would have looked like to run a dark adapt on him, back before he converted, So I don't want to have to live through that again. So I guess it goes back to kind of like, you want to be a good doctor for your patient. You want to kind of, take yourself even sometimes out of your comfort zone just to embrace some new technology or bring it in to kind of, hopefully catch those things before they cause a preventable vision loss.
Awesome.
Yeah.
Well, for kind of what's next for you, obviously you're going to be doing a lot more consulting and teaching, and I'm thankful for that. What is that kind of your next project? Do you think you're just going to continue doing more and more of that?
So I'd like to. I believe I need to stay doing some, patient care.
Yeah.
That informs everything that we do when we lecture. I'm sure you can understand that completely. So I believe I've got to see patients, and I think 2.5, 3 days a week is great. But yeah, I think to your question, I'd love to travel more with my wife. Right now, like we still have I've got 3 children, 2 are college age. And they're home right now, so I definitely cut things back in the summer. It's really nice.
Still gotta feed the college kids.
Exactly right. And they're amazing young adults. I've got a bald spot because I've got 3 kids, but at the same time, like they are just outstanding people. I'd love to be around them. But what's hard about traveling, as you can imagine, is you're traveling away from your family a lot of times. So, I think down the road, I'm a 5-year plan kind of guy. 5 years from now. I'll have a couple kids probably out of school, and my youngest daughter, who's 16, will be probably in school. And I would like to continue traveling, but with my wife. That's a good answer?
Sounds like a great goal. Maybe we'll have her on as a guest because she's an OD as well, right?
She is, yeah. So, yeah. I wonder if she would do an episode. She's not as, I would say, extroverted as I am.
Okay. Yeah, it takes all kinds. We're all different.
She's brilliant. She's way more brilliant than I am. But yeah, she's an amazing clinician. She's outstanding.
I can't wait.
I'm biased, of course.
I can't wait to meet her. But
yeah.
Thank you so much, Tim, for being here. It's been a real pleasure. I look forward to hopefully having you on as a guest in the future because I know we both share some passion around nutrition and just diving deep into that science around eye health, ocular nutrition. And so
I'd love to.
We'll save that for another episode.
That sounds great. Awesome.
Thank you again,
Thanks for having me.
enjoy the rest of your experience here at the AOA and Optometry's meeting.
Great. Thank you so much, Joey. I appreciate it.
Thank you. So that was our conversation for today. Thank you so much for joining us. If you are enjoying this type of content, please do yourself a favor and follow us either on your favorite streaming service or subscribe to our channel over on YouTube, because that will go ahead and remind you whenever our next episode is coming out. And if you're somebody who is finding a lot of value in this content and also gives a damn about your profession of optometry, then please do us a solid favor by leaving us a review on whatever streaming service you are using. That will greatly help us out and help more professionals find this content. Otherwise, again, thank you for listening in, and I hope you have a fantastic day. We'll see you soon.